Hello everyone, welcome to today's segment series provided by Beaumont Health System. I am Sameena Syed, a senior physical therapist in Beaumont Health System, and I'll be your guide as we navigate through our topic today, physical problems after having a baby. Let me begin by introducing myself. I'm a physical therapist and I specialize in pregnancy, postpartum, and pelvic rehabilitation. I treat women during their pregnancy and also with issues after having their baby. I also treat individuals who have urinary issues and bowel issues like incontinence, pelvic pain, constipation. I treat women, men, and children who are suffering with these issues. Pregnancy and postpartum. A woman's body undergoes a lot of changes during pregnancy, and those changes continue to occur even after having a baby. Many women suffer through their pregnancies having pains in their backs, hips, pelvic area, along with leakage of urine, and these issues continue to happen even after having a baby. Many women suffer with these issues, and these issues tend to increase further with multiple pregnancies. By educating that there is help for these problems that occur after having a baby, we hope to reach out to all those mothers who can benefit with physical therapy treatments. So let's begin to talk about postpartum. Postpartum is the time that starts after delivery, and it can last up to 3 months or until the mother is able to return to her previous level of fitness. Physical problems after having a baby could be multiple, and it can affect different issues, and some of them are listed as musculoskeletal issues, abdominal issues, pelvic issues, postural changes, weight gain, and fatigue. Some of the musculoskeletal issues that can occur. Pubic symphysis pain. This is present mostly during pregnancy, and it should resolve right after having a baby. But when this pain continues even in postpartum after having the baby, it is possibly from weakness in hips and core muscles that got really worked on during pregnancy time. There are sometimes infection that can also happen in the pubic symphysis, which may need a clearance from physician and may need further treatments from the physician. Low back pain. Low back pain is one of the major pain that patients experience during pregnancy and sometimes lingers even after having a baby. Weakness in core and hip muscles occurs, and it could be possibly from a bigger fetus size. Pain could be arising from sacroiliac joints, which is possibly from the ligament laxity from pregnancy hormones. Disc herniations can occur from pushing during vaginal delivery. Poor postures with daily living, like poor lifting and carrying positions of the baby or feeding positions, can also cause low back pain. Thoracic or mid back pain. Possible causes are poor posture, poor feeding positions, lack of proper supportive garments such as ill-fitting bras that needs to be adjusted to accommodate the size of the breast post-pregnancy. Poor lifting and carrying techniques of the baby can also cause mid-back pains. Pelvic issues that can happen after having the baby. Incontinence. Incontinence is leakage of urine, or it can be leakage of feces as well. Leakage of urine can occur during pregnancy and can continue to happen after having a baby. Some of the causes of leakage of urine is weakness or underactive pelvic floor muscles, constipation, episiotomies, forceps or suction delivery, trauma from vaginal delivery itself can cause weakness on the pelvic floor muscles and cause leakage of urine. Pelvic pain. Pelvic pain is from tight or overactive pelvic floor muscles. Pelvic pain can cause pain with urination, pain with bowel movements, pain with sexual activity, constipation, and also urinary retention or urgency and frequency of urination. Sexual dysfunction. It's inability or difficulty to participate in sexual activity after having a baby. Some of the causes are pelvic pain, which is spasms in vaginal or pelvic muscles, episiotomy scars that can be from decreased mobility in the scar itself or pain, trauma to the vaginal area by use of forceps or suction delivery. These are some of the reasons that can cause pain and difficulty with sexual activity. Prolapse or seals. There are different kinds of prolapses that can happen. One is a cystocele, which is descent of the bladder and bulging into the vaginal area. Rectocele is descent of the rectum and bulging into the vaginal area. Some of the causes of prolapses are weight of the fetus itself during pregnancy, bearing down to deliver with vaginal birth, constipation. Multiple pregnancies increases the chances of prolapses. Having to bear twins and triplets also can cause weakness in the vaginal wall, causing prolapses. Diastasis recti. It is the splitting of the rectus abdominis muscle, which is present in the front area of the abdomen. Rectus abdominis is one of the six-pack muscle, and it can get affected with the size of the fetus or having to have multiple fetuses like triplets or twins. It usually occurs during pregnancy, and it can also be a cause of back pain from ineffective abdominal muscle engagement. Constipation. Constipation is described as a condition in which you have fewer than 3 bowel movements a week or having to have hard or dry small bowels that are painful or difficult to pass. Some of the causes of constipation is hormonal changes during pregnancy itself, which slows down the mobility or the motility of the colon, C-section scars, pain medications, and dehydration. Scar tissue. Scar tissue can occur from cesarean C-sections or the C-sections that a woman could have for birthing. The scar needs to be healed with no pain in the scar by 6 weeks after a C-section surgery. A C-section scar could also limit the mobility of the colon, causing constipation. It can also cause abdominal or pelvic pain. Breast pain. Breast pain, which is painful swollen breasts, a firm mass in the breast sometimes presents with redness. It could be possibly from a block in the mammary ducts. Avoiding wearing underwire bras is one of the best recommendations to be given to prevent mastitis. Mastitis is infection of the mammary ducts. If a person has chills, body aches, and fever more than 100.2 degrees lasting for more than 24 hours, there's always a possibility of infection in the mammary ducts. This requires medical attention and treatment by antibiotics through your physician. There are a variety of treatments available to address the problems that occur after having a baby. Here are some of the treatments and skill techniques that can be used. The type of treatments chosen depends upon the information a physical therapist can gather during an evaluation of a patient when they come in for post-op or postpartum treatments. The therapist then determines what is the most effective treatments for the patient. At Beaumont, our treatment programs are researched and evidence-based and are shown to make a real difference in treating pelvic and abdominal dysfunctions. Patients are also educated in proper posture, body mechanics in terms of lifting, carrying, pushing, reaching, diapering, nursing, bathing, and proper placing the baby in and out of the car seats without irritating their backs and causing back pain. Our recommendation to mothers that continue to have pelvic abdominal problems after having a baby is to make an appointment with their physician or gynecologist so that a proper diagnosis is made. If you choose to have a conservative option of treatment, ask your doctor if physical therapy is right for you. Beaumont Health System has physical therapists that specialize in abdominal and pelvic dysfunctions. Beaumont offers multiple treatment locations for physical therapy. We hope with this presentation, we are able to reach out to all those mothers who have some of these pelvic and abdominal issues after having a baby. And we hope that you are able to discuss this with your physician and to address your issues as there is help for these conditions. Thank you.